I produced this breast revision video because I want women to understand the long-term effects of what breast augmentation can do. Breast revision surgery is really not talked about a lot in general because what it means is that there's a problem, there's a complication, or there's an issue with a woman's breasts that are bringing them back into the office to try and correct. It's important for a woman undergoing primary augmentation to understand that this is a long-term marriage with these implants and that they take maintenance over time. The video will take you through a 6 to 7 months period of time with these women, and these women are going to tell you their story. I hope this will be very helpful for you. Michelle, thanks for coming in.
Yeah.
And I understand that you're here regarding a breast revision. Is that correct?
That's correct.
Okay. Can you sort of give me a history going back to when you first got them, maybe why you first got them? Can you kind of go through that,
sure.
please?
Yeah. I got them in 90, it was 96, the first one,
Mm-hmm.
and no, 1990. It was 1990 because I was about to graduate from college.
Mm-hmm.
And I got them. I had wanted them. My mom wouldn't sign off and wanted them when I was a lot younger because it's very lopsided. It's aesthetically just not very lopsided.
Mm-hmm.
To where I would only wear big baggy t-shirts and so finally I get them done. And it was
How old were you then?
so I had to wait till I was 18.
Okay.
So when I was 18, I got them done and loved them. Everything was, my changed clothes, my attitude changed, everything was different. And the only reason we had them changed years later is I got into a car accident and I had saline or silicone in the original implants. So I had them done again and...
So you were in a car accident and what happened from that? Was there a rupture from the accident?
Luckily there wasn't, but they could tell there's the outer shell The outer shell stayed intact, but the inner shell ruptured. But nothing had leaked. There was no silicone leak.
Okay.
So they did that. So I just had that surgery again, and everything. That was all fine. But now 10 years later, I'm having problems again because they're encapsulated. They feel hard. They're uncomfortable. They hurt. And then just wanting to get an idea from you as to what my options could be.
Sure. Now let me go back a little bit. So your first implants were in 1990, and they were saline implants. Got into silicone implants.
Yeah, earlier were silicone.
Okay. And you got into a car accident, which injured them to some extent. And so so that was from 1990 to 1996. You had them changed out in 1996 and you went to normal saline. And why did you switch?
It was whatever was healthy, known to be healthy at the time.
Okay.
So they had the big controversy with saline versus silicone and back and forth. And
were the implants put under the muscle or on top?
over.
They were put on top. And each surgery they were put on top. Okay. Let's go over again what your primary complaints are.
They're hard, so they feel like what the nurses tell me are encapsulated, so they're hard. They're starting to look uneven.
Look uneven?
Yeah, I mean, and I don't know if that's a normal, sense of aging or whatever, but they just don't look the same anymore. But one's definitely harder than the other. One hurts more than the other. So I think that has more to do with it.
Okay, and are there any issues with the aesthetics of your breasts other than just the implants? In terms of your skin, is there any issue of sagging or anything in that dimension?
Yeah, I think because if they are sagging, and I'm pretty sure it's because, and another doctor told me this also, I think you confirmed it once, That because of the weight of the implant being out over the muscle is pulling the breast down. So yeah, I could definitely, if I walked out of here with nothing, it would be a lift.
Mm-hmm.
It would have to be a lift.
So that's a problem too for you. Yeah. So it sounds like you have a few problems. Number one, you've had 2 surgeries, so you have scar tissue present. They're on top of the muscle, and they've hardened, at least one more than the other. And so, in addition to that, you have loose skin. So that's a very complex, problem overall. Is the size comfortable for you?
Yeah,
that
I'm
you are
definitely
now?
comfortable with the size. Like I said, when you asked bigger or smaller, everybody's like, "We're going bigger or smaller?" I just want to fit in my bras, the ones that I already have.
So that's your primary goal.
I just don't want to have to, because my physique, I can carry off a little smaller, I can carry off a little bigger, so just ballpark would be.
Okay. There's a variety of ways of doing this. I mean, obviously, we have to take out the scar. We have to relocate the implant from on top of the muscle to underneath. And thirdly, you need a lift. Now, sometimes it's difficult to just do a lift on the table because you don't have your landmarks very well. You've got an implant in, it makes it somewhat more complicated. One thing I like doing, and this only applies to a person that has saline implants, is we can actually drain the implants of the saline before surgery. We can mark out your breast to get a more accurate sense of what needs to be cut out, how far the nipple needs to come up, and I think we get a more accurate idea of that. So, I'm proposing that because I think that we can probably make it more accurate like that. Okay, but I must also say that you do have, complicated case. We definitely try for perfection and we do the best we can. We never reach it, but we try to, and you seem like a very realistic patient in terms of not wanting something that can't be achieved, or bringing in pictures of Britney Spears, or I do get that at times where patients want to look like this, and they don't understand why they can't. It seems like you understand all the dynamics involved, and so we'll definitely work hard to get you what you want. Okay.
That's good.
Any other questions you have?
No, just one, because you guys are so good at getting back to me when I have questions. What would recovery time look like? Knowing that it's going from over the muscle to under the muscle.
Yeah, I would say you could probably drive in a week. I would probably say in the 4 to 6 week range. A lot depends on how you heal. Again, you're having a lift. We still have to look at your breast to see what kind of lift that you're a good candidate for, because there's various types. Certain ones you're going to heal better. Certain ones it will take longer. So once I look at you, I'll give you more idea of that. Well, let me show you some pictures. I think show you some patients that have had hardening, and give you some ideas of things. Okay. All right. These are just some examples of patients that have had issues with their breast implants, and this is a woman that's had breast contractures. You can see how kind of ballish it is, and this is what it is. It's the actual capsule, which is a calcified scar tissue often, and it houses this implant, and you can see the scar tissue is a lot smaller than that. So it just squeezes it over time as the scar tissue kind of constricts, and that's how it becomes hard. So you really have to take out this entire thing. You know, and that's what we like to do. And in your case, fortunately, we're going to be able to take it out from above the muscle and put the implant into a virgin pocket underneath, which is great for you in the sense that you have a little bit better chance of not hardening again.
Right.
So anyway, you can kind of see how much nicer and softer her breasts look. We'll look at this one here. You can see how the distortion is. Oftentimes, as a breast contracture occurs, the breast goes upwards, as everything contracts upwards. And you can see how both of them are sort of distorted. Then afterwards, the capsule comes out, much softer. It, you know, it lays natural. In other words, she still has a lot of skin. She's an older lady. She's 50 years old. So they're not to look like a young person's breast. That there's no lift or anything like that. But the hardening is what causes people discomfort often.
Right.
So that just gives you a few ideas of some of the implants. Any questions?
Mm-mm.
Okay. All right, let's do an exam. So basically, you've had 3 surgeries so far, and this would be your 4th. Okay. Now, going back to 1999, you wanted implants at that time because
I'd had 3 kids, and you know, gravity just kind of
Okay.
takes over. And
so you wanted volume improvement.
correct.
And do you know if you had saline implants during
Saline.
that time? Okay. And do you know if they were under the muscle or over?
Under the muscle.
Under. Okay. Now you had the implants in how long before you had the mastitis? 5 years?
Yeah, 4 or 5 years.
Uh-huh. Can you tell us what happened when you got mastitis? What was that like?
Like, I was probably within 8 hours. They took out an IV liter of infection of
Really?
pus that was
Oh,
that
my
was
goodness.
in and around the tissue. So it was painful.
Yeah, I'm sure. So they took that out and you did not have that in for how long?
8 months.
So how was that like, having one implant in and one not?
It was emotionally, it was harder than it was physically. Because physically, you can always, you know, you can buy those fillers for your bra, but emotionally, I think it was hard.
It was hard, yeah. Having to go back, you know, again.
Again. And
So now, what size implants were they at that time,
the ones that
roughly?
they had taken out were about 300, 350.
Okay. 350. And so when they went back and replaced after the mastitis, they put in another 350.
No, they put in like a 260 or between 270 and 300. I think
Okay,
is
so
what-
they put smaller ones
smaller
in
ones in.
at that time.
Mhm.
Okay. And so now that brings you up to where you're at now.
Yes.
Okay. So can you explain to me what's going on since that time and what the current issues are?
Well, the left breast dropped, and the right one kind of is like creeping up to my throat. It's like it just like keeps getting higher and higher and higher. So this one I can do flip flops with my implant, and this one's like as hard as a rock. So these ones just didn't work.
And are these saline as well?
Yes.
Okay. And how often did the hardening occur after they were placed in, would you say?
Probably about a year.
About a year. And it just, did anything happen to cause it? Just one day you noticed
Yeah,
something
just
happening?
something wasn't right.
Yeah.
And so, and it just over progression of time, it's gotten harder, and this one's kind of just hanging there in the wind.
Mm-hmm. So, what are your goals right now, would you say?
To look normal.
To look normal.
To look normal. To be able to like put on a sports bra without having to cinch it so tight so that I can run or wear a swimsuit.
Uh-huh.
Would be
And
nice.
you can't wear a swimsuit now?
I can if I cinch it really tight.
I see.
So it's uncomfortable.
So it's very uncomfortable. Okay. If you had to do it all over again, you have breast augmentations, knowing what you know, and you're going through a fourth now, how would you respond to that?
I probably would have waited till I was done having kids.
Uh-huh. Okay.
And then did it.
Okay, so you think having the kids may have, prior to brought in other aspects of complications, which does happen. The mastitis can happen from breastfeeding, the having kids, having engorged breasts will stretch them out again. You'll need to have other surgery. So I think that's a very good point. You tend to have a little bit less issues afterwards because your breasts go through a lot until you have kids. So hopefully we can get you back on track. One of the problems with having complications like you've had, and you're a young woman,
Thank you.
that this may not be the last surgery. In general, if a person has contractures, they're more likely to have them again. If everything's even done right, it doesn't have anything to do with anything other than now you have a lot of scar tissue in there, and the more surgeries you have, the more scarring you have, the more deformities and things that do happen. So we always have to keep that in mind, and I always tell patients that once you have your implants, you're going to have issues, but I don't recommend having surgery until it's to the point where, okay, I need it now. Okay? You don't want to go back for just a small issue. You want to go back because you really need to, because you don't know how many times you're going to have to do it in a lifetime of maybe 80 years, and then, and so, each time you do it, it's scarring. It's financially more expensive, and so I think that you have to kind of pace yourself, with your implants and the issues that develop. Okay, and I think you've done a good job. I mean, obviously, the mastitis you can't avoid. That necessitates another surgery of putting them back in, and now the disfigurement and the hardening is to a point that is very uncomfortable and embarrassing. So, I mean, you've done it all right. You haven't, jumped the gun. I don't think on anything. So, just so I understand, just to summarize, you had them first put in 1999 after kids to increase your volume. You developed, and those were normal saline implants under the muscle. 5 years later, you developed mastitis, and you had to have the left implant taken out. There was a lot of infection found in there, so the implant was taken out for 8 months. You went back in, you had that implant replaced, and then you subsequently had in 2003 a third surgery, being new implants and a lift. Is that correct?
Correct.
Okay. And so when you say that you want to look normal now, can you kind of explain that in terms of your actual breast? What are you looking to achieve? So it gives me some, and I'm going to examine you, and you can point it out, but I like to hear it in your own way.
For them to be even.
Even.
Because one's lower and one's really high, so just to be even to where you can wear a normal bra.
Gotcha. And that's the primary goal that you have. Is the sizing okay? You want to be larger, smaller?
A little bit bigger to fill the skin, I think.
Okay. obviously, you know, every time you go through this surgery, the same risks apply: infection, bleeding, contractures, deflation of the implants. Have you thought about whether you wanted saline or silicone?
I think silicone is.
The fluids come out now. We've taken them out, put new implants in, and it looks fine. Okay, well, thank you very much, and we'll get going to our exam.
Okay.
Perfect.
Absolutely.